Thank you for that warm introduction. I must tell you that I feel like I am among friends. I'm hearing that there was a land acknowledgement and community agreements. And I just want to echo that, I am presenting today from the unceded territory of the Piscataway, and I'm very happy to be a part of West Baltimore, where if you know anything about the city and about the history, it is a place where this idea of tackling inclusivity and thinking about equity are very, very real topics that, personally I see on a day-to-day basis. So to be able to bring my oral health knowledge to the space with librarians and learners and people who are committed to sharing knowledge, it's just very important for me. So I just want to acknowledge that. So I also have to start, because I am among family, with giving some shout outs. So a special shout out to Deborah for all that she's done to make today happen, and to the amazing Region 2 librarians at Meharry Medical College, Ms. Sandra, Ms. Vanessa, and Ms. Claire, who were very, very generous to me in supporting my being able to do this work around health equity and racism in oral health. I don't know where I would be without them. I wouldn't have gotten all the articles that I needed. And then to my favorite co-author and the Region 1 librarian superstar at VCU, Erica Brody, who has brought me into the 21st century in terms of my abilities to navigate and use resources, and has also helped me to be a deeper thinker and a more engaged scholar. So for all of the people who are listed here, I just want to give shout outs, thank yous, and immense gratitude. And also have to acknowledge that some of the work that I will share today is work that I've done in collaboration with Julie Reynolds, who is an associate professor at the University of Iowa College of Dentistry. So who are you getting today? Today, you have a dentist who, as you can see from me in action, like I do clinical dentistry, but I am not the dentist you will ever schedule an appointment for an exam or cleaning, because I am the big mouth dentist. So the middle picture shows me doing some advocacy work around oral health benefits in Medicare. And then I'm also the dentist who is a voting dentist. And if it is election day where you are, I hope you go out and do what you need to do. But my understanding of oral health and my understanding of myself as a scholar, investigator, administrator is really someone who is in the world and doing work that is very important, and important not just for me as a Black woman who is a Southerner, who is a descendant of enslaved Africans, but also as a person, again, living in West Baltimore and seeing a world that I know can be a better place. So our plan for today is to explore these learning objectives, which I'm guessing that you probably read, or else you wouldn't have come here. So you've got some interest in these topics. And so I hope that we can do them well in the time that we have together. So exploring inclusivity in the context of social justice. So because we have our community agreements, and whether you put this in the chat or you just take a moment to reflect, I'm curious as to what inclusivity means to you, and whether you think about that in the context of your work. And I am making the assumption that most of us in this Zoom are librarians, or you are working in a library space in some capacity. What does inclusivity mean for your work? As people in the world, and I saw in the chat that we have a colleague who's Zooming in from Puerto Rico, I wonder, what does it mean to be in a world either in the contiguous US or in Puerto Rico or other places that people may be Zooming in from? How do you understand inclusivity in terms of your lived experience? Now, for me, I have lived in a world where I am typically the odd person out. Right. Go into a lot of spaces where I don't see a lot of Black people, Black women. I also go into a lot of spaces with the dentist where, because you cannot schedule an appointment for me to do your examination and extract your teeth, I'm a little bit of a oral health weirdo because I'm out here doing epidemiology and doing research. So for me, I think of inclusivity from the idea of being from the outside looking in. And I also wonder, as we think about these spaces, to what degree are we creating opportunities for people to see them in our work, in our spaces, and not only to see themselves, but to feel that there is this sense of belonging to where I can join you in a Zoom with my natural hair and my favorite glasses, and I can use language and share with you my lived experience. And I know that it's going to be safe and okay for me to do that. Right. So, how can we make inclusivity a part of how we work, how we live, and how we our community with others? So here's a definition that, again, you can read. But what I liked about this definition and why I wanted to share it is that there are some key words here that I think are important for us to keep in mind that don't often come up as we talk about inclusivity. So one, inclusivity is, a practice and a policy, which probably we would think about, right? If we're thinking about creating these spaces where we can have this sense of inclusivity, certainly there's going to be a policy or practice that undergirds it. But also this idea of a mindset. Now, I come from a tradition of mindfulness practices. So this idea of a mindset to me is very tangible. Like it's something that I can identify with, because it also tells me that if inclusivity is, a mindset, it has to be a lived, embodied practice, right? It has to be something that I do in order for it to happen. Right. And this definition also sets up this way in which we can contrast inclusivity with diversity. And I think sometimes they kind of all get jumbled into, the same container. But, it's, as the last point makes, like you can measure diversity, but it's slightly harder to measure inclusivity. And as an epidemiologist, I love to measure and I love to count. So this idea that there is something that we cannot quantify becomes, an interesting intellectual exercise, but that also means that it has to be something that we observe. So if you take nothing else away from our time together, I hope that you will take a moment to reflect on the ways where you are able to observe inclusivity and look for those opportunities where you can embody it, right? Because I think at the end of the day, that is the work that we all are called to do. Now, in this context of social justice, there's this idea again, if we can differentiate inclusivity from diversity, it then makes us think, so what are we talking about? And what am I as an oral health professional, as an epidemiologist thinking about? Now, perhaps you've seen some version of this image. It's kind of a classic, I think, at this point. And I remember when I first saw this with the equality and equity, I love the idea of, you give everybody a box, they can see over the fence. You give boxes according to need, which is equity, and the person who needs extra boxes are able to see over the fence. It never dawned on me until I saw this tweet that instead of giving people boxes, what we could do is just take the fence down. Right. And so this idea of inclusivity in the context of social justice is in many respects doing that embodied work, doing that work of having the practice, having the policies, but also doing it in a way to where those boundaries that either keep people from entering spaces or have some people feeling othered and outsiders, why not just take the fence down and let everyone come under the tent, as it were, or to create a seat at the table where everyone can partake in the meal, or whatever metaphor, is your favorite for describing this idea of community. But at some point, you know, inclusivity has to serve some greater good. And personally, I'm not convinced that equity is it, right? I think that there is this greater push towards social justice, which we can imagine in the different spaces where we live, what that could look like. But at the end of the day, I would hope that we can agree that it's people who are able to be their authentic self, to operate without fears of retaliation, without fears of judgment, where they can take care of themselves, provide for themselves and their loved ones with a sense of safety, security, and with adequate resources to be their best selves. And if we can agree that that is our goal, then certainly inclusivity can be one of the tools to which we can achieve that end of social justice. Ooh, I went too far. So with a little bit of language under our belts, inclusivity, thinking about social justice, now the question becomes, how does anti-racism, anti-oppression fit into this? Now, because we have our community agreements, I hope that we are joining this conversation of learning around anti-racism and anti-oppression with an open mind. Because undoubtedly at some point in the slides that are to come, you may hear something that I hope you will land on you well, to where you can unpack it and understand it, and again, apply it in the environments where you are. So what do I mean by this? What is anti-racism? Very simply, not racism, right? I mean, anytime you see anti in front of something, it's like the opposite. But it's the opposite with a bit more nuanced, right? Because here we're talking about, not just looking at changes in systems and structures, but there's also this degree to which we are redistributing power in an equitable, and I would modify this to say, and in an inclusive way. So what do I mean by this? We all have privileges to some degree. The fact that we are able at this time of the day to join a Zoom is a particular type of privilege to how we work and make a living that not everyone has. So knowing that we all have privileges, how are we willing to use how we are positioned, how we are situated, and maybe give up a little bit of our power, a little bit of our influence, to make sure that that fence that is sometimes racism, that fence that is sometimes oppression, maybe goes down so that someone else can step forward. Right. And we can think about doing this in a myriad of ways. I mean, I mentioned voting if it's election time where you are, because that's one way that you can kind of exercise your power and your privilege. But there are even fewer, less costly ways, right? Because voting, you can say, maybe has some potential impact. But think about the people that you hire if you are a hiring official. Think about the students and staff that you mentor. Think about the spaces where, again, you can bring others with you and create that space of liberation, of openness of thought, the space where there is an opportunity for all of us to contribute in meaningful ways. Now, Ibram Kendi, and I hope that you have either read some of his work. This is coming from How to Be an Anti-Racist, but to this idea of inclusivity being a mindset, being an anti-racist is also a mindset, right? It's a radical choice to do a reorientation of your consciousness, whether that's unpacking history and how we are conscious about making land acknowledgements, conscious about the communities where we are potentially working and living, and especially if it's a community where you're not from there, right? I'm not from West Baltimore, but I feel that there is a connection for me in the space where I have to orient myself not as a Tennessean, but as someone in a community where I am a newcomer. But how can I be a productive member of a community? So where are we willing to, again, do the work, to share some of our privilege, to take on this radical reorientation, this new mindset, this new consciousness around inclusivity? Now, this is a long, long quote, and usually you're not supposed to put a lot of words on a slide, but it's Iris Marion Young, and I couldn't help it. So who is Iris Marion Young? Iris Marion Young is a political theorist, a feminist thinker, a great scholar. In her work, Justice and the Politics of Difference, she helps us to think about oppression and the idea of creating a multicultural society doing the work of democratic justice. Right. And again, in this progression of us thinking about inclusivity, layering on anti-racism, I bring oppression to the table because, well, Ibram Kendi and scholars who've been doing work around racism will certainly agree, racism is just but one structure, right? And really what we are looking at is oppression, is the fence, however the fence is built. Wherever there are norms, habits, symbols, rules that essentially place us in a position of us versus them, right? And you can see it in terms of, actually there's a slide that does it better. So you can see it in terms of all of the different systems where oppression may happen, whether we're talking about classism, sexism, ableism, homophobia, transphobia, ageism, you name it, right? You name it, and it all falls into one of these categories, right? And the beauty of being able to see oppression as the problem is that someone like me, who spends a lot of time talking about racism, trying to push for anti-racist practices and policies in the spaces where I am, while I'm talking about racism, you could almost take it out and put in your ism du jour, and it's going to work the same way. Because at the end of the day, that radical reorientation, that mindset of inclusivity, if we're able to do it correctly, if we're able to do it and tackle the immigration system, to tackle the historical forces, to tackle the globalization, the colonialism, the occupying territory where people are living that belongs to other peoples, right? If we can do this well, the idea that we're not just in this alone, right? Where we're no longer othering, where we are able to, again, be the proponents for justice, wherever we happen to be in, whatever spaces that we are in, to do that work with some success. And not success in the way that I'm doing it as the savior, right? I didn't come to West Baltimore to save a community. Right, the community already has the resources, they can do that work. I'm just coming in as an ally, as a helper, as someone who can lend my voice and my skills to hopefully making things better. But if we can do that with, again, embodied intentionality, there's this unique opportunity that we can land in. Now, for me, I think about this a lot in oral health. And I say oral health because, there's this sense that if we say dental, right, people are going to think about teeth. And that's important. All right. And by the way, if you haven't brushed your teeth today, please do that. And please make sure that you floss before you go to bed. And please make sure that you stay hydrated and drink your water. And all of those things are important for your oral health, right? Now, if we take the behaviors out of the picture and look at oral health more broadly, there are numerous opportunities where this thing and this practice where I have a license to do the work is not just about optimal oral health, but it's about optimal oral health in the context of anti-racism. So I have been lucky enough to have spent the past, I don't know, maybe year and a half. I feel like I've been doing this for the bulk of the pandemic. So I guess this work got started in really July, August of 2020. And with the American Association of Public Health Dentistry, we started to create a new mindset, adopt a new lens through which to see ourselves and our practice. So the figure on the left is a white paper that we published in 2021. And it is a call to action where we are holding ourselves accountable as a specialty, as a discipline, to say we can be anti-racist. And it's going to look like this. It's going to look like this in education, in practice, in science, in advocacy. This is how we're going to do the work. And because I don't know what it looks like in your profession, but I've seen a lot of white papers in the days when things were published where it would be, this big splash for a white paper, and then it would go sit on a shelf somewhere and no one would ever use it. But we were intentional, right? So we made sure that our white paper had some action to come with it. So in, I think it's on the 22nd of June, but sometime later next month, there is going to be a special issue of the Journal of Public Health Dentistry that is dedicated to the topic of anti-racism. Now, why this is important? This is important because oral health is one of the fields that's typically a couple of steps behind, right? We're not trendsetters by any stretch of the imagination. So medicine, public health, nursing, pharmacy, there are a lot of other disciplines that have been very engaged in doing this work for decades. So we're coming a little bit late to the party. However, we're coming to the party saying that we're going to make sure that our journal features this very important topic so that we're able to educate, again, the readers. And you may have seen, and hopefully in your discipline, there have been some issues that have been special issues of journals that have been related to anti-racism, or statements that had come from organizations, but not just statements that we will be anti-racist, but statements that come with action steps and programmatic work that you can see. But it's telling to me that for a discipline that is often a few steps behind, that we are willing to put our privilege to the side to say that we need to do this work, even if it may be slow, even if it may make us a little bit uncomfortable. We need to be willing, we need to have the mindset of inclusivity to see how we can do better, and do better in the following areas. So this is the reality. The reality is that there are over 200,000 practicing dentists in the US in 2020. And now that I'm thinking about our colleague who's zooming in from Puerto Rico, I now have a question about these data, because now I'm wondering, do these data include dentists from Puerto Rico? So why is that important? That's important because if you scroll down to this last little area here with 2020, You see that, the US population by this thing called race has that, ooh, I went too fast. Has that, 18.4% of the US population is classified as Hispanic, but yet 5.9% of dentists. Right? You can do the same thing looking at Black people who identify as Black, 12.4% of the population, 3.8% of the dentists. And this other, which is a very sad catch-all, but speaks to the issue of our data not being anti-racist, is that we don't even know. We don't even know for American Indian Alaska Natives, for Native Hawaiians, for Asian Pacific Islanders, for these other groups of people who, because of history, we know have special challenges in accessing care, in getting into pathways to become dental providers. We can't even bother to differentiate. So with our other, we've got 3.6 of the US population, but 2.2 of the dentist population. Now, in one regard, you can look at this and say, well, Eleanor, I mean, it is what it is. But look over time, right? If you look over time, you see that the orange and the green aren't growing very much in the dentist workforce, right? And what also is telling is the overrepresentation of Asian dentists per the US population. Now, if we are serious, again, about inclusivity, about creating workforces that reflect populations, of doing the work of creating opportunity, this slide alone suggests that as dentists, we have work to do. And there's a similar picture to be told about dental assistants, or I mean, dental hygienists. There's a similar picture to be told about dental therapists. So as we look at the dental oral health workforce, we've got an underrepresentation of people where those same members of the population bear disproportionate burdens of disease. And that's problematic. Now, because I'm in an academic setting, and because I'm guessing that most of you are working in academic settings, the question becomes, well, Eleanor, you told me about the dentist workforce, but what are we talking about in terms of faculty? Now, this is where, and again, I'm Southern, so you're just going to have to forgive me on this one, but this is where it's just a sin and a shame. Like it does not make sense, right? It makes no sense that we can look at the numbers of faculty members, and they're enough that we can kind of count them on, that we can easily count them. All right, 16 full-time American Indian Alaska Native dental faculty, 10 Native Hawaiian, other Pacific Islanders. And again, I draw our attention to the Black and Hispanic or Latino numbers as they're categorized here, because again, it makes you wonder, what is it about a profession that can put forth these numbers? And we know that, sometimes, not all the time, but sometimes it's having that faculty member, it's seeing yourselves reflected in a profession that helps people to know that they can be a dentist. But if I am, someone who is not represented in a dental school or at an institution where you're working, whether it's, and a similar picture can be told. So I'm telling you the stories from the world of oral health. Similar stories can be said about medicine, nursing, pharmacy, but looking at who is in the room and who is teaching and who is supporting becomes very, very problematic if we are to do this work of inclusivity, if we are to do this work of social justice. And I also want you to consider, as you look at the spaces where you're in professionally, who is represented? Who is represented in the space of librarians? And if you can look around and you're able to count with a few fingers, people who are probably in the same groups of dentists, I ask the question, what are you willing to do about it? Now, again, so we start with the data, and now thinking about what this means in terms of practice. Now, if we think about this idea of science, right? I mean, it's really examining the role of racism. And I like to think, and we're going to get to this in a few minutes because I was able to find some resources, but I remain curious that, in the different professional spaces where we are in, to what degree are we talking about the made up category of race, but not talking about the real experience of racism? Right. And I offer some resources here as essential readings for health researchers, but also for, again, for those of you who may be supporting them. I would be curious to know if you're working in a space with dental researchers. So if you're affiliated with a dental school, how many of those people who are your colleagues have read, the first article, David Williams, Racism in Health, right? And it's a seminal piece. And it's a seminal piece because he's making the argument that should not be new to any of us who've been paying attention during the pandemic, that racism is killing people. But we need the evidence, we need the research to demonstrate that. So would it be helpful to your colleagues to just share that as food for thought? Right? If they're coming to you and they're sending you lots of, as I did to Miss Vanessa at Meharry, asking for all of these articles, maybe sharing something that might support their work, just some food for thought. Now, from the policy and advocacy space, and again, I realize that for most of us, this isn't a space that we live in, but it's important to know that there are policies that help us to do the work of ensuring that anti-racism and those systems and structures that create the fence fall down. So whether it's in Medicaid policies, whether it's in community and state initiatives that improve equity, that create access to care, all of this falls under the umbrella of efforts that we can do around anti-racism. And we've talked a little bit about workforce just in the image that I shared with you. But again, we can be intentional in removing racism from the workforce. And I don't say that as just words on a slide. I truly mean that. And part of the work that I'm doing now is to try to make sure that at least in the spaces where I'm working, at least in the place where I have a seat at the table, that we're able to remove that barrier. So whether it's in, resourcing dental providers to make sure that they understand that sometimes the language that we use in talking to students, the ways that if a student presents like me with natural hair, there's no reason to think that I'm not professional just because my hair does not conform to a standard of professional look that you may be used to, right? All of these different challenges, these biases, these lenses through which we can essentially judge and other people, how can we do away with that? And of course, again, to this idea of ensuring that oral health services to Black, Hispanic, American Indian, Alaska Natives is a priority for all providers and not just for some. Now, in dental education, and again, assuming that most of us are working in academic settings, it's thinking about, for me especially, but again, for those of you who have seats at the table in in spaces outside of the library, how can you support cultural shifts? Is it a matter of, bringing in, information, is it a matter of sharing with your colleagues like, hey, there's this new article that's coming out about racial and oral health equity in dental school curricula. Have you read it? Have you thought about it? Do you want me to help you look for resources that can help you to teach racism in your dental education class, in your medical education class, in your nursing class? Now, those are practical steps that I think we can all do, in addition to, you know, the heavy lifting that some of us are going to do, which around making sure that accreditation bodies support anti-racism. But it also begs the question that if your profession has an accreditation body and that accreditation body has not supported anti-racism and the training of future yous, what does that mean? And if it means if it means to you what it means to me, which is that it's problematic, are you willing to ask the question? And trust me, will be asking the question soon to some people about dental education. So stay tuned for the next good trouble that I find myself in. So I've taken you through the space of oral health. And I'm sure somebody was thinking, but Eleanor, we're not on the oral health team. What does this mean for you? I mean, for me, yeah, because you would be asking me. So what would it mean for you? You know what I'm talking about. So I did a little research to think about the space of libraries, inclusivity, and anti-racism. And I found this, like someone has done the work, you know, and I shouldn't have been shocked, but I was pleasantly surprised to find this work. And because it's 2019 and we're in 2022, I hope that you've read this before. I hope you're friends with Carla and you're supporting the work that she's doing. But I found this to be a fascinating read because what Dr. Strand has done is give us the blueprint. Right? She has gathered the resources and pulled them together so that you can think about the ways in which, again, you can tackle inclusivity through this pathway of disrupting whiteness in your library. Right, and in all the ways that you can do it. And I'm just giving you a snippet of screenshots that I thought were interesting reads. But, you know, this idea, this second one here, the activist health sciences librarian. Ooh, that just sounds like a must read. Social justice and the medical librarian. Like, if that doesn't make you want to like get out of bed every morning and go to work because you're doing the work of social justice as a medical librarian, like, I don't know what will. Or even critical librarianship. Now, all of these things to me suggest that there are opportunities for you to both resource yourself if you haven't kind of gone through Dr. Strand's reading list, but also, again, to do the reflective work to see where you can support a change in your personal mindset and also bring it into the space where you're working. Now, my new thing is to leave people with homework, although I frame it as thoughts for action, which is a softer way of saying this is your homework. But I encourage you to consider these questions, all right? How welcoming is the physical space of your library? How inclusive are the materials in your library? What does belongingness look like for you? And how can you leverage your privilege and power to be an ally or sponsor to someone? Now, I realize that these are all big questions, things that can't be conquered in one webinar or one moment of doing the work, but to this idea of being the activist, the engaged health sciences librarian, are you willing to do it? And if you're not willing to do it, that's cool too, right? You just have to make the choice. Like that's not what I'm built for doing, and that's fine. But if you're willing to do it, just know that you've got a big mouth oral health epidemiologist who's going to be willing to stand with you. right? Because this work of anti-racism can't just happen in oral health, can't just happen in public health, but it has to be work that we do in all of the settings and all of the systems and structures where we happen to be. So I said that we were going to do some things. And so I hope that you have an understanding of this idea of inclusivity, how it fits in social justice. And again, if you take nothing else from this, what we're doing is building a mindset, changing a mindset. How inclusivity, anti-racism, anti-oppression potentially fit together. I gave you some examples from oral health. And now I am tapping you to go out and be the change agents where you are. And I've been using this figure to end my talks recently because I think it speaks to what this is all about. Onward together, right? Just like one of these people can't, if they let go, like they're going to float off into the ether somewhere, right? We've got to stay holding hands, doing the work, building ourselves up, getting the resources so that we can create the spaces that we need and for the people who depend upon us that they also need. So with that, I will stop the presentation of sharing and open it up for questions. And thank you for listening.
That was awesome. I know we all got some great resources, and I don't have any questions yet in the chat. So if you guys would like to, you're getting some claps. Hey. So if you guys have any questions, you could drop it in the chat, or you could raise your hand, or you could just unmute yourself. And if you don't have questions, that's okay. It's a lot to take in, but we have so many good resources now, action steps and information that can help us do a better job. I'm going to give you guys just maybe a minute or two to process any thoughts or questions.
And as you're thinking, not to, take up the space from your processing, but, I'm very curious just to know if anyone is willing to share just from a experience piece, how did this land for you? Right? Does this land to where like, oh, Eleanor, I'm old hat at this. Like, I already knew all this to begin with, but thank you for the refresher. Or was this truly new information for you to think about your role as a librarian and this idea of doing this new work, which again, I low-key kind of am bringing you into this space of doing the work of social justice? Because I got to tell you, I see libraries as very radical spaces. So in my mind, I'm like, they've been doing this forever. My library is where I got my COVID test and my mask and all of these things. So I automatically see libraries as this space for this work, but I don't know, with the health sciences. Oh, I see
Fleming, Erica's hand is up.
Thank you. So I think, well, some of this content is familiar. I like how you pulled it all together in a novel way. I think what makes me a little sad is recognizing that the librarian profession, at least academic librarians and particularly academic health science librarians, that the diversity is actually worse or even less diverse than the dentists and the dental faculty. So we have a lot of work to do. I think we have a lot to do in terms of pipeline and bringing people into the space to see this is a good career. They need to see other people that look like them and faculty that look like them. So it's very chicken and egg. But I think, another challenge with this career is that you have to, most cases you need to get a library master's, which comes with a price tag and time. And the salaries for once you're out are not like commensurate with being a dentist, right? So we have this tension between the professionalization of librarianship and creating this barrier to entry. And I mention this tension sometimes, and I haven't heard anyone tell me this is how we solve it. And I just came back from Medical Library Association's annual meeting, and we had some programming about diversity and inclusion. And I only hope to see that we'll continue to have more. People are writing books about this. Cultural Humility in Libraries is a book where the chapters are being drafted now. But it's a lot. We have a lot of work ahead of us.
Yeah, and I appreciate you raising this point, Erica. And by the way, this is Erica who got the shout out. Just if you didn't realize, she is a real person. You raise a good point about, the pathway to the profession. And, this is a space where, I've been thinking about from the perspective of oral health, but I think it starts, at the same way. It's like, to what degree are we willing to mentor and support that next generation of us? Because I mean, you say that, there's a salary difference, but, I'm in academic dentistry. No one gets into this for like the come up. Right. I mean, my friends who are, where you schedule the appointments for the exams, I mean, the salaries are in no way compatible. So I've got the same hard sell, well, a similar hard sell. I shouldn't say that's the same, but a similar hard sell to tell a dental student like, hey, don't you want to be a professor where you've got this other hurdle? To your point, you're going to have to get a master's degree or some additional training. And so I think that for all of us, we need to, in our professional spaces, continue to have those conversations of, are we really setting up barriers so that we only get people who are resourced enough to be able to clear them? And that's why our professions look the way they do. Or are we willing to say, go to your local historically Black college or your local minority serving institution to say like, hey, young people, here's a path for you. And here's the way that I can help you to navigate it. And I can't say that it's going to be lucrative in the end, but these are the benefits that I've gotten from doing this work. And, I think that there's a power in our stories of being willing to share how this work is important to us. So Lorraine has put this point about, the difficulty of recruiting. And, I've often wondered, when it comes to recruiting for any position, how can we do that with more intention and also do it in a way that our institutions know our worth, which is a total nother, barrier to conquer. But, to me, if an institution, I shouldn't say this, but I'm going to say it, if our institutions, as wealthy as many of them are not willing to put the resources into the backbone, which I consider a library to be a backbone space, what does that mean? And how can we potentially advocate to make sure that people know, like, our libraries need money too. Like, I appreciate that you're building a new lab for XYZ person, but if that lab is not kicking a little bit of money over to the library so that we can get them the journal access and the things that they will need to do their work, but also that students will need to learn, like, what are we investing in? So I wonder, and this is, I guess, more of a thought question, but I think it's very real. How do you make the case for the work that you do, which again, I see it as being essential, but I don't know that other people making decisions at institutions have that same feeling or would be willing to invest in, say, the professionalization of someone, supporting their development so that they can come back and work and give of service to the institution. Yeah, Lorraine, I always point the finger at the accreditation agencies, which probably tells you a lot about me and how I see the world. But yes, I do ask the question, like, again, so in dental education, which I'm probably as sure in a lot of others, but well, I can speak from medical too, right? Like they have these, equity, DEI accreditation goals, which really, they're as loose that you can paint your success in any way to say that you've met the criteria, even if you've done nothing. So you could have recruited 0 Hispanic, American, Indian, Alaska Native, or Black students in the last 4 or 5 years, and you would still count, right? And it makes you wonder, like, why do we do the performance? Why do we do the performance of saying that we care about diversity, right? Again, that thing that we can quantify, without doing the work of asking the question, to what degree do we actually value inclusivity? Because I think if we ask that question about inclusivity, it's going to make you look at those policies and practices and say, maybe we do need to actually put more accreditation weight around our diversity, or making sure that if we want equity taught as a part of the curriculum, that we are being very intentional in saying that we just don't want cultural humility to be taught, but we actually want people to understand the impacts of oppression or whatever it happens to be. So I think that there's this way of, reframing questions,
Any other last minute questions, folks? I have about a 1.5 minute spiel. So if you have any questions while I'm doing that, if you pop it in the chat, we'll answer it. Otherwise, we'll have no more question and answer. So just so you guys know, if you didn't think to look in the chat because you were so enthralled, we will be sending out survey information, which will have embedded in it what you need to do to get your MLACE credit. We'll also send out the slides, a copy of the recording, and we'll do that within a week once we gather everything together. What I'm seeing now are great thank yous and kudos, and I second that. Thank you again, Dr. Fleming, for that wonderful presentation. I was so excited, and you far exceeded my very high expectations. So thank you for sharing your wisdom and insight and tools. We really appreciate you.
Well, thank you. And again, I didn't put it here, but if I can be a resource, please don't hesitate to contact me. Again, my expertise is largely in oral health, but, I'm a big reader, so I'm happy to share, the things that I find. And, as I said in the end, like, this really is onward together. And I feel like if we can get enough people thinking, asking questions, going to these conferences and raising their hands with the tough questions, that the accreditation bodies, the professional groups, others will have to get on board. Because trust me, that AAPHD white paper came about because I raised my hand and asked the question, so what are we going to do? Because we better not just release another statement, because I'm not paying money for that. And so sometimes you do have to go and make your concerns known. And again, letting go of using some of your power privilege to do that. So. Oh, and Jeanette, when you get those Onward t-shirts, let me know where I can order one in a small so that I can represent together.
All right. Thank you guys so much for being active and engaged. And we look forward to seeing you at future events. And Dr. Fleming, we can't thank you enough. Everybody have a great day.
Bye.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.